Welcome to the South Bay Council of Governments Board of Directors meeting for Thursday, October 22nd, 2020. Can we verify that there is we have verified that there is a quorum?
There is a quorum.
Can you confirm the posting of the agenda by the Torrance City Clerk?
Yes, it has been posted.
Are there announcements of any changes to the agenda?
Yes, I wanted to say, I don't know if it's in the chat or not, but we did receive a report on the Hawthorne Airport Community Impacts Committee, and that should have been circulated separately, or we'll put it in the chat, but it is one of the reports that came in after the packet got mailed.
Thank you. Are there any public comments? Are there any public comments? Seeing none, let's move to the consent calendar. May I have I'll entertain a motion to approve the consent calendar if any, unless there is someone who would like to pull something off it.
So moved.
Thank you. May we have a second?
Second.
Okay, we've been moved and seconded that the consent calendar be approved. Let's do a reverse roll call, please.
Anybody opposed to approving the consent calendar? Any abstention? Okay.
All right, so the consent calendar has been approved. We will now move on to presentations, and all prepared presentations will be posted at www.southbaycities.org. At this time, I will introduce Britt Huff, council member from the city of Rolling. Britt Huff. Oh, seems like I'm having a little bit of a technical difficulty here. At this time, I will introduce Britt Huff, council member from the city of Rolling Hills, who will introduce the speaker.
Rolling Hills Estates.
Rolling Hills Estates.
Thank you. And I think our guest is here. Oh, yes. Good. Welcome, Dr. Dar. It's my pleasure to introduce our speaker this evening, Dr. Eric Dar, MD from the Lundquist Institute here at Harbor UCLA in Torrance. I was a member of the foundation board of the Institute for many years, which was formerly known as LA Biomed. And so I made it my mission to inform the local public of this wonderful jewel we have right here in the South Bay, where physicians who are trained at top medical schools from around the country practice medicine and do breakthrough cutting-edge medical research. And they also all have faculty positions at the David Geffen School of Medicine at UCLA. And Dr. Dar is one of our local stars. He is chief of the Division of HIV Medicine at Harbor UCLA. He's a research investigator through the Lundquist Institute and a full professor of medicine at the UCLA Geffen School of Medicine. He has more than 25 years of experience in providing HIV care and conducting related research. Because of his extensive virus research experience, Dr. Dar was tapped by Dr. Anthony Fauci at NIH to direct the South Bay Stage 3 COVID virus vaccine trials for the AstraZeneca study out of Oxford, United Kingdom. This is one of the top 3 ranked studies along with Pfizer and Moderna. So it's very exciting to have this study take place right here at the Lundquist Institute, where it's easily accessible for participation by our local population. Dr. Dar will be available for questions after his presentation. So I will now turn the program over to Dr. Dar. Welcome and thank you so much for being here to give us an update on the COVID virus and research in that area. Thank you.
Great, Britt, thank you so much. And thank all of you for the opportunity. Obviously, COVID-19 has been a huge part of all of our lives. And we've heard a lot about issues related to prevention and treatment. And I'm going to give you an overview, although the focus is going to be on prevention and vaccines. I do want to touch just a little bit on treatment, particularly a major study that's being conducted here in Los Angeles, as well as at the Lundquist Institute in the southern part of LA County. So as Britt mentioned, the Harbor UCLA campus has on it what is now called Lundquist, formerly LA Biomed. And before that, for those of us who've been around long enough, it was even REI. But basically, it's this nonprofit independent research institute that's been there for over 60 years to support the research activities of the faculty at Harbor UCLA, where our primary mission is patient care and teaching trainees. I have a dual role, like so many of my colleagues, where I have this full-time commitment to the medical center, but also conduct research on the Lundquist campus. The building that I do this research in is what's pictured here. It's called the Chronic Disease Clinical Research Center, or CDCRC. And this is where all of our research participants go and where all of our research staff live. So let me just briefly update everybody, relatively updated information on the pandemic. It's hard to keep up. For those who watch CNN, you see it on the banner bar on the right, around the clock. The update mostly from this Johns Hopkins database. At the time I pulled this data was back in the middle of September. Here we are beyond the middle of October, and there's not probably closer to 40 million confirmed cases, over certainly globally over 1 million deaths. And if I focus you on what's going on in the US, about 8 million infections. And as you know, we've been one of the leaders as far as death, with now over 220,000 deaths. And then some other areas that have been heavily affected, including Brazil. And as we are all aware, this seems to go not in phases, but more like a wave or roller coaster of cases going up and down, as we've not been able to really contain this throughout most of the world. We are currently in the midst of an upswing of at least new infections, as are many places in South America and Western Europe. This is looking at data in the United States. The figure on the left are cases of infection, the right are deaths. The darker the color, the worse as far as the number of cases and deaths. And you can see California is one of the most heavily affected states, and about half of what's going on throughout the entire state is going on here in Los Angeles County. As far as numbers, both cases and then deaths, you can see that we are also one of the most heavily affected parts of the country. One of the early observations with all viral infections, but particularly with COVID, was that the virus that causes the infection or causes the disease, called SARS-CoV-2, affects everybody a little different. And we learned early on in China, and this data is extended here throughout the Western world, including the US, that there are certain risk factors for having a worse outcome. And we know that there are now up to 30–40% of people who get infected who have no symptoms at all, but can transmit to others. And therefore, the reason why we're recommending everybody wear masks until this pandemic comes under control, because we can't tell who's potentially infectious or not. But we know that a subset of people, probably the estimates are less than 1% overall, will go on to die, and maybe 15%, or maybe a little less, go on to require hospitalization. But some groups are at higher risk than others. As we've heard, the very young are at very low risk for disease progression and certainly death. But one of the risk factors that's been clear from the beginning is age. And you'll often hear people talk about seniors over 65, but really if you look at this increase, and this is rates per 100,000 population, it really goes up incrementally with age, with over 18 being somewhat higher than less than 18, over the 50 to 64 group, and here's the greater than 65. And if we broke it down as 75 to 80, it would just continue to rise. So we know that while the overall risk of death is about 0.5%, that varies depending on the person's age. And there are other risk factors along with age, including other comorbid conditions like diabetes, hypertension, heart disease, kidney disease, and obesity, to name a few, that people who have those conditions are at also greater risk for a bad outcome. And this is important because if this disease just caused a runny nose, like most coronaviruses have in the past, we wouldn't be having this discussion, yet alone having locked down the country and had, the catastrophic effects on the global economy. It's because of these bad outcomes. So in addition to older people and people with comorbid conditions, we also appreciate that certain racial ethnic groups have been disproportionately affected. And this is some data, again, it looks at the rate of infection. This is hospitalizations though. So these are the more severe infections per 100,000 population. So it adjusts population. And you can see the biggest numbers are American Indian and Alaska Natives, non-Hispanic Blacks, and Hispanic or Latino population. And then it drops off quite a bit for non-white Hispanics and non-Hispanics. So we know that it's disproportionately affected people of color. And we have a large population of such here within the Los Angeles County area. As far as the reasons for it, I mean, it's possible that there may be some genetic factors, but more likely it's of the environment and other conditions that this population are affected by. So we know that, the risk factors for getting infected, not surprisingly, are essential industries, people who have to go out to work, people who interact with large numbers of people, as well as people who are perhaps living in multi-generational households in limited space. These kinds of situations are more common amongst our communities of color. We also know that they're more likely to be affected by things like diabetes, hypertension, and obesity. So it's a bit of a double whammy that's probably driving most of this difference. And that's the circumstances in which they work and they live, as well as the accompanying conditions, medical conditions that they have. So SARS-CoV-2, the virus that causes the disease that's called COVID-19, causes a variety of symptoms. We generally think a lot about the respiratory symptoms, congestion, runny nose, cough, sore throat, shortness of breath, but it can cause headache, muscle aches, joint aches, fevers, chills, nausea, and diarrhea, all very common. And then there's this other very unique symptom that is very unusual, but almost specific to this condition, and that's this loss of taste or smell. And again, these are for the people who get symptomatic. Initially, we thought the majority did. Now we appreciate 30–40% do not develop any symptoms at all. When symptoms develop, it tends to occur within 2 to 14 days after an exposure. So the average time from an exposure to developing symptomatic disease is probably about 5 to 6 days, but it can be as short as 2 and as long as 14. And that's why you'll often hear people talk about if you've been exposed, that you should quarantine yourself for 14 days to assure that you don't develop symptoms and then potentially expose other people. So that's where that 14 days for self-quarantine comes from. But again, some people never develop symptoms. So how do we respond to a pandemic? Well, we haven't had that many really catastrophic pandemics. And as you know, the biggest one was the influenza almost 100 years ago now, where we had a transmitted respiratory infection that was associated with significant morbidity and mortality. So the government responded very quickly to the pandemic and developed this Operation Warp Speed. And again, I think everybody is starting to hear more and more about this, mostly driven by the politics, but it was actually a really effective and functional group that was put together with the whole idea of addressing the pandemic as quickly as possible. So they developed this group, this project called Accelerating COVID-19 Therapeutic Interventions and Vaccines, so-called ACTIVE. And this is a public-private collaboration of people from industry, government, numerous agencies within the government like the CDC, FDA, NIH, and others, as well as academia, to try to develop studies and treatments for disease and strategies for prevention. And I summarize sort of the key things that are being looked at through Operation Warp Speed. From a treatment perspective, it's focusing on the best way to treat the sickest people who are hospitalized, who have severe disease or even are critically ill in the intensive care unit, as well as an effort to treat outpatients. And we'll talk a little bit about that at the end. From a prevention perspective, the main way we've managed viral infections with prevention is through vaccines. But other strategies that have been widely used and very effectively used in HIV, where there's been challenges in developing a vaccine, is using antiviral drugs either prior to an exposure or after in the so-called pre-exposure, post-exposure prophylaxis. And all of those things are being pursued at rapid pace through this Operation Warp Speed. So this is how SARS-CoV-2 is transmitted. It's primarily respiratory secretions, mostly through these large droplets that when they come out of one's mouth or nose, they quickly drop to the ground. And in general, unless somebody has a vigorous cough or sneeze, these kinds of large droplets are not going to get to somebody who's 6 feet or more away. So we all know about the social distancing. We know about the 6 feet rule. That's driven by the reality that most respiratory viral infections, including SARS-CoV-2, are transmitted in these large droplets. So if you're more than 6 feet away, short of someone coughing or sneezing at you, you're unlikely to then inhale those droplets. Now, some of them drop to the ground, which is why we need to make sure our surfaces are clean and wash our hands a lot. And then the other thing that's gotten a lot of attention is this aerosolization, and people often refer to it loosely as airborne transmission. This is where it's not large droplets, but small droplets that actually float in the air potentially for hours. And there are certain viral infections in which this kind of transmission is pretty common, like measles and chickenpox. Not usually these kinds of infections, but there is pretty good data saying that this can happen. It probably amounts to a relatively small amount of the total transmission events, and probably is mostly occurring when people are in an enclosed area with poor ventilation. So mostly the focus has been on droplets, the large droplets, and we can prevent this from happening by putting masks over people's mouths and nose so these droplets do not get expelled, and maintaining a 6 feet distance so that the droplets don't reach somebody else's mouth, nose, or eyes. Now, mostly the masks are to protect other people from us, but it probably provides a little bit of protection as well by covering our own mouths and nose. Obviously, it doesn't cover our eyes. So this is the strategy for prevention to date. Here we are, 10+ months into the pandemic, and the way we transmit SARS-CoV-2 or prevent transmission is with masks, social distancing, and hand hygiene. It works, but it obviously is quite cumbersome and difficult to maintain. So as part of Operation Warp Speed, they established this COVID-19 Prevention Network. This is the website. If anyone's interested in getting more information, it's at coronaviruspreventionnetwork.org. And you can see if you go there, it gives you information about clinical studies, what to expect, the science, frequently asked questions. And there's even an opportunity if you want to sign up to volunteer as a participant in one of the vaccine trials. And through the COVID-19 Prevention Network, the United States has committed billions of dollars towards the rapid development of safe and effective preventative vaccines, working with industry, testing numerous different vaccines almost simultaneously. So normally when one starts to think about a vaccine, we analyze the virus. The virus became available very early in January after the epidemic was first described. We think about ways to develop vaccines, and lots of them exist. We introduce them into animals to see if they're safe and if they induce any kind of an immune response. Then we do the human trials. We start with the phase 1, small studies to look at, again, early safety and whether it does anything, try to optimize perhaps a little bit the dose. Then we do phase 2, which goes from studies of dozens or 100 or so people to hundreds, if not maybe approaching 1,000, to try to figure out what the best dose is. And again, to see if there's promise, see if it induces the kind of response that we think is important to prevent infection from occurring. And I emphasize, I keep saying, the kind of response that we think is important, because we don't definitively know that just because somebody develops X, that it will prevent them from infection. Once it goes into those phase 2 trials and it moves on to phase 3, these are large trials, and these trials have been on the order of 30 to 60,000 participants per vaccine study. And in that case, you're definitely looking for safety, but you're also not just looking for whether it induces some kind of a response that you think is important, like antibodies, but most importantly, you're trying to see if it prevents disease. And for this particular infection, that really is what you need to do, right? If this was just asymptomatic infection or a cold, we wouldn't be having this discussion. The reason we're having this discussion is because some people get very sick. We need to prevent that from happening. So you do these large trials, and then if it works and it looks promising, then it goes to the FDA, they approve it, you develop factories, and you build product. Now, often when you're developing new treatments, building product means for thousands, 10,000, 100,000 people. Here, we're looking to develop enough product to immunize 7 billion people, 330 million here in the United States alone. And some of these vaccines are going to require 2 doses. So this mass production thing is not trivial. So this is the timeline for vaccines when they're effective. It generally takes on average over 10 years. I think the quickest vaccine that was developed and approved was 4 or 5 years. And it's because, sorry, this doesn't project better, you know, you have to do the basic initial research, then the animal studies, then the early phase 1, then the phase 2, then the giant phase 3 studies. If it works, you then build factories, you manufacture product, and then you get it out there into the population. This is slow. This is no way to manage a pandemic where people are dying every day. So what the federal government did through Operation Warp Speed is they said, we're going to do every single one of those steps, but we're going to do it quick, and we're going to do them all at the same time practically. So they condensed the timeline so that as they were learning more about the virus and doing the animal studies, they were giving it to humans. And then as they were giving it to a few humans, they were giving it to more humans and starting the phase 3 trials as soon as there was a signal that anything was working. And rather than wait until those things are done, see if it's effective, and then start to build factories, they started building the factories immediately. So this is no way to run a business, right? Spending billions of dollars potentially on developing factories and product for hundreds of millions of people, even before you know if the product is going to work or ever get approved. But from the federal government's perspective and from a public health perspective, this is the way to address a pandemic. And if you can do it in 6 or 7 vaccines at the same time, you increase the likelihood that you'll get at least a few that will actually work. And if you're lucky enough that you get more than 1 or 2 or 3, you also increase the likelihood of being able to meet the global needs of billions of people, because you'll have multiple vaccines being rolled out within perhaps a year of the initiation of the research. And that's where we're at right now. So there are a variety of different vaccine strategies that are being pursued. Almost all of these are in the works. I don't have the details on a slide, but I can tell you that some of them are simply using genetic material. The first 2 large vaccine trials that opened in the United States through either industry or this Operation Warp Speed was a Moderna product, which uses this viral RNA for injections, 2 injections per person, and then the Pfizer product. Both those studies are approaching completion as far as enrollment, and now what they're waiting for is enough people to get sick to be able to demonstrate that those who received the vaccine were significantly less likely to develop disease, not infection, but disease, than those who received the placebo. The other strategy that's being pursued is using a common cold virus called the adenovirus that is impaired so that it can get into the cell but can't replicate. And once it's in the cell, it will produce the protein, the surface protein, the so-called spike protein of the virus, not SARS-CoV-2, nothing even close to it, just a small piece that we think is important for the immune response to target to prevent infections. And this has been rolled out in the 3rd of the major trials that's being pursued, and that's the AstraZeneca vaccine that we're using here at the Lundquist Institute, and I'll tell you a little bit more about that in a minute. But it's also being used in other vaccine strategies that are moving forward, including the J&J or the Janssen vaccine study that just opened a couple of weeks ago. And then there are other vaccine and other strategies that are also being looked at. So this is the vaccine we're using. This is the Oxford University developed and partnering with AstraZeneca vaccine. It's using a common cold. It's actually a chimpanzee cold virus. And this was the early phase 2 data. So 500 people received the active product, and they monitored them for symptoms. And you can see the common things that you see with vaccines: chills, fatigue, fever, feverish, headache, mild joint pain. The orange color here represents mild disease, mostly gone over the course of days. No serious adverse events, no hospitalizations. So in general, based on the early data in 500 people, it seemed to be safe. And I can't emphasize enough that you cannot get the cold virus and you cannot get SARS-CoV-2 from this vaccine. It just doesn't exist in a form that can cause disease. So these feverish, fever, chills, this is just an immune reaction to something foreign. This is not infection by any of these viruses. And then you look for these immune responses. This is looking at things like antibodies. They basically saw it in everybody. And this has been true in the vaccines that are all moving forward. So they're inducing antibodies that we think are important. And now we have to prove they're important in preventing disease in the large phase 3 trial. The AstraZeneca trial is a trial of 30,000 individuals. 20,000 will get the product on day 1 and day 28, and 10,000 will get placebo on day 1 and day 28. Neither the investigators or the participants know whether they were getting the real product or the placebo. And ultimately, the plan is to then follow them closely. And if they develop any symptoms consistent with SARS-CoV-2 infection or COVID-19, then they rapidly come in and they get tested. Now, the whole timeline for identifying whether this works is based on how long it takes to get enough people who are sick in the study. So the answer will come quickly if we enroll a lot of people who are at high risk for getting infected, so people who are getting out there and doing things, and who are also at high risk for developing symptomatic disease. Our seniors, our communities of color, our people with comorbid conditions like diabetes, hypertension, obesity, and things like that. And fortunately, we have a lot of these in the Los Angeles area, and Los Angeles has several sites doing these studies. The AstraZeneca vaccine is being done at USC, UCLA, and at the Lundquist Institute at Harbor UCLA. So it's a great opportunity for LA County to be a part of the solution in trying to identify a vaccine. Let me just tell you, many of you may have heard, there have been some stalls in the process. Although over 20,000 people in Europe, South America, and South Africa have received this AstraZeneca vaccine in a trial that's being conducted in those countries. The study here in the United States was open for 1 week before a single event of a complication, an unexpected complication or potential complication in somebody in the United Kingdom led to the entire study being stopped here and the study throughout Europe and South Africa and Brazil. So the study was halted on September 6th or 7th, or they say paused, while each of the regulatory agencies in Europe and here in the US reviewed this single event. And the European group reviewed it quickly and felt comfortable restarting the study after just 2 weeks. We've been paused now much longer because the United States FDA has been incredibly careful in asking AstraZeneca to provide all of the data about that particular case in question, as well as all the data about another concerning case that had occurred before our study started, asking for all the safety data on every single human being that's received this vaccine around the world to make sure that there were no safety concerns that were missed, as well as everyone who's received a vaccine using this chimpanzee cold virus. So the FDA has been going, first they had to get all the data, then they've been going through it. And then there have been all sorts of stories about them planning to reopen the study. But right now we've not heard any specifics. I'm optimistic that it will reopen based on everything we've heard, and it will reopen within the next week or so, but only time will tell. We've been primed and ready to go. We started enrolling and then we had to stop. We have lots of volunteers. Particularly, we're looking for volunteers that fall into this ideal study population characteristics. Our seniors, people who are over 60, people who have these comorbid conditions, and our communities of color, who are getting out into the world and potentially exposed. Obviously, somebody who's locked down is going to be in their home is going to be very, very safe. And that's great for them until we sort this out, but they're not the right people to include in these studies. So this is our website. It's helpstopcovid.la. If you're interested in getting more information about this effort, helpstopcovid.la. And there's, in addition to a lot of information, there's the opportunity to sign up if you want to be considered as a participant. And again, you or anyone you know that's interested in participating in a clinical trial in the development of a vaccine. This is one of our flyers. And let me just talk very, very briefly about treatment. There's a major initiative to develop treatment for people at all stages of disease. Most of the focus has been on people with moderate to severe disease who require hospitalization. Less effort towards these people with mild disease who are not hospitalized. This represents the overwhelming majority, probably about 90% of people who get infected are initially identified before they progress to needing hospitalization. We don't know who will progress to hospitalization other than we know certain people are at greater risk than others. At this point, if somebody is diagnosed with SARS-CoV-2, they don't require hospitalization. We tell them to stay home, drink lots of fluids, take Tylenol, and isolate themselves from other people. There is a major interest in trying to look at therapeutics that could increase the likelihood that they, one, get better quicker, and two, don't progress to requiring hospitalization or potentially death. So we have treatments, and everybody's heard a lot about this recently with the experience that Trump went through with his case of SARS-CoV-2. We've got antivirals that we use in hospitalized people. We have steroids that we use in hospitalized people. We have nothing for these people with mild disease who are at risk for progression. And that's what we're targeting, is trying to identify people early on to reduce their risk of progressing to hospitalization and death. And there's a study called Active-2. So this is also part of Operation Warp Speed. This is going on around the country and will be opening up around the world. There's over 40 sites. There's several sites in Los Angeles, including at the Lundquist at UCLA and USC and a few more. Where basically what we're doing is we're taking promising agents that we think have activity, antiviral activity against SARS-CoV-2, and that can be given to outpatients. And if they look promising in the early studies, and this schematic just shows how often we see these people. Initially, we give them the product and then we follow them and we look for reduction in symptoms, reduction in nasal shedding from the nose, as well as how their oxygenation is doing. If the product, one of the new agents, and we can have many new agents going through this at the exact same time, then it moves on to those big phase 3 trials to see if it actually prevents things like hospitalization and death. So it's called Active-2. This is the website, active-2.org, or risingabovecovid.org. And it brings you to this website. This is the national website where you can get additional information. And there's a way to go into this and speak to a live operator if somebody finds out they're infected. And they will identify a site closest to you and directly link you with somebody at the site, you or whoever needs it, to hear a little bit about the research. The current study is using one of the monoclonal antibodies, not the one the president received, but another one just like it. It's also shown some promise in preventing people from progressing to more severe disease. So again, just so you're aware that there are things for us to do for people who are identified in the outpatient setting to try to empower them to hopefully participate in research and help us develop new treatments that will protect them from getting sicker. There are also studies looking at household contacts to prevent infection. This is our flyer, and with that, I will stop. Thank you all for your attention, and I really appreciate the opportunity to share this with you.
Dr. Dar, thank you so much for that wonderful presentation. Are there questions for Dr. Dar? I don't see any hands. Please use the raise hand icon. Are there questions? Jennifer Lamarck?
Oh, Sure. Hi, Dr. Dar. Thank you for that presentation. My name is Jennifer Lamarque. I'm with Supervisor Janice Hahn's office. And you may know that she did a motion back in September that directed the county health departments to put together a plan for distribution so we're ready as soon as it's available. Can you talk a little bit about how you see the distribution going once it is available?
Yeah, I mean, obviously, none of us know for sure how this is going to all play out. But what she's done is exactly what everybody needs to be doing, and that's planning ahead. I mean, it sounds so simple. We find something that works, we get it approved, we create the machines to manufacture the product, and then magically 330 million people get it. It's just not going to work that way. And that's why when people talk about timelines, yes, it's conceivable. If enough people get sick early from the Moderna and the Pfizer trial, it's conceivable we'll have a positive signal by the end of the year, early next year. No promises, but it's possible. But then the next big step is mass production and distribution. And I think everybody believes that that's going to probably be done in a stepwise fashion. So if you put on your crystal ball and say, well, we don't have anything right now. There's no hint from what I've heard, that we've got a company that's ready to present data that demonstrates that they work yet. That could happen in a month, but we need that to happen. We need the FDA to weigh in on it in one form or another. Then we need to get product, and then we need to distribute it, and we need to distribute it wisely because it's going to take months. Some people say 6 months, some people say a year before a large enough number of people get it. But we need to expedite the process and target the highest risk people. So it makes sense to target our seniors, target our communities of color, target our people who have these comorbid conditions that put them at the highest risk, because they're the ones we want to protect from what the study's demonstrating, and that's a reduction in the number of people with disease. So again, that's going to happen. That's the timeline, at least in my fantasies. Of course, that assumes facts not in evidence. That assumes that one of these vaccines are going to work and that they're going to be safe. I'm optimistic. There's no reason not to be, but that's still assuming quite a bit. The other big challenge many of you have heard is that the vaccines that are out in front are the Moderna and the Pfizer vaccines, just because they started a little bit earlier. And of course, things like the pause for AstraZeneca, the Janssen product was also paused. We're waiting for that to reopen as well. They're out in front. They're the ones who use that RNA injection. For genetic material to be stable, it needs to be stored on, either dry ice or in what people talk about as a -70 or -80 degrees Celsius freezer. These are not freezers we have in our homes, or we have at local pharmacies, or we even have it in clinics. Nor do we necessarily have enough dry ice to distribute this all over the world. So there are going to be unique challenges that people are already starting to work on, and how to not just mass produce it and to create a list of how to prioritize it, but to actually get the product to where it needs to be. Often in resource limited settings, we talk about cold chains where something just needs to be refrigerated, and that's challenging in poor countries. This is frozen at -80 degrees. So it's going to be really interesting once things start to roll out. Hopefully we'll have multiple positive signals and we can do this quickly, but it's months away. And if you think about how many people are going to need to be vaccinated before we can all stop running around without masks on and having to be as cautious, it's, best estimates, this whole so-called herd immunity, 60–70+% of people will need to be immune. That's a lot of vaccines. And then of course you've all heard, because we have so much vaccine hesitancy before COVID, and it's not getting better with COVID, it's not clear how we're going to be able to persuade people to take the vaccine even once we know it works and that it's safe. And one of our commitments in LA County, especially working at a safety net hospital, is we realize that there's a lot of lack of trust with researchers in the medical community amongst our populations of color who are in these groups of very high risk. So our hope is that we can provide education and information to share with them, that they will be willing to participate in the trial so we can demonstrate that it's safe and effective within those communities, to hopefully then to be more effective at promoting it to them once we have a good vaccine that we can give them, so that we don't have a subsets of the population who choose to not become immune and continue to allow themselves to be at risk. A long answer to probably the most important next question. So thanks.
Thank you, and thanks for the work you're doing.
We have a question. Thank you. We have a question from Britt Huff.
Yes, we hear a lot of discussion and confusion about the whole herd immunity through the actual viral infection versus vaccine. Would you be able to clarify that a little?
Yeah, sure. So the whole herd immunity concept is that there's enough people in our communities that are immune that when somebody does get infected, they can't spread it, right? I mean, obviously we don't want anyone to get infected. We don't want anyone to get sick and die. But from a public health perspective, what's really important is if somebody does get infected, they don't spread it to a lot of people. And then certain viruses are more easily transmitted than others. This one is not the easiest, but it's easier than, for example, influenza. So if you can sort of build a circle of trust of people who are immune around everybody, and then the number that you need to do that, I think the best estimates are probably on the order of about 70% of the population. And obviously there are regional differences that are extremely important as well. We see regions in which we see these measles outbreaks, and that's because people aren't getting immunized. So we're losing that herd immunity. One person gets infected and they infect all the people around them. So 70%, that means if we do it through a vaccine, we have to have a vaccine that's highly effective. We don't know that we'll have that. Not just effective, but highly effective. And we need to get it to 70% of the community. Now, if we choose to do that without a vaccine through natural infection, that's an awful lot of people who are going to need to get infected. I mean, that's over 200 million Americans that will need to get infected. And that assumes that all of those people will develop immune responses that will protect them from reinfection, not just immediately after they get sick, but also months later. And as you probably know, we're still not 100% sure how good the immunity is in all people who have recovered from infection, both initially and how quickly it wanes. The best evidence suggests it probably does wane. So the people who have made the arguments for allowing this to happen by infection are likely putting a lot of people at risk for serious disease through the process. It will be very slow and painful for that to happen. And it may very well be that even after it happens, that all those people that we think are protected may not even be protected. So I think it would be catastrophic to consider pursuing it down that path. The best way to do this is with a safe and effective vaccine, if we can build one.
Mm-hmm.
Dr. Dar, thank you so much for that presentation. I'm sure everyone we're very illuminated by your presentation. And I'm afraid, unfortunately, we're going to have to move on.
Oh, I appreciate it. And I know others, Britt for sure has all my information. If anybody wants to reach out to me or has additional questions, please do.
Thank you so much. Thank you.
Bye.
Bye-bye.
May we have our transportation reports? First, the Metro report.
Steve? Are you there, Steve? Can't see my
Yes,
screen.
I'm here.
Okay.
Now, can you hear me and see me?
Yes.
Yeah.
Okay, great. Metro Board met today. They approved the next gen process and program for implementing, for the first time in 20 years, route restructuring, trying to improve the reliability and the frequency of short-term trips and the simplicity of long-term trips. They expect the program to roll out in 3 different tranches. December, they'll do some simple changes. Then they'll come back in June and then the following December before it's fully implemented. There was some discussion about the fact that in this period of reduced revenues due to COVID and such, we aren't going to be able to serve 7 million daily trips. We'll be down around 5.5 or 6. So the public has been saying, the stakeholders have been saying, you're cutting service. That's not really true. They're providing the service at the level of demand that that is coming to the buses and the trains. with social distancing. And the next gen is just going to make those trips more efficient. So they will add trips to prevent overcrowding. But this restructuring is very important. One of the things that got discussed, Supervisor Hahn was very concerned that the Silver Line, which runs from El Monte through downtown and then comes down the 110 freeway, was going to be ended at the Harbor Transit Center. Right now, there's a bus that goes from San Pedro straight downtown. That bus is going to turn back at the transit center. She was not very happy when they did not make a change. There wasn't a vote about it, but staff just explained their position and the meeting moved on. So there may be additional discussion down the road as to how we get a direct train or bus trip from San Pedro all the way downtown, how we don't lose that in this next gen program.
There used to be one from the peninsula too, but that was truncated a while ago.
Yeah.
Were there any other impacts to the South Bay that we should?
And there was a corollary discussion of microtransit. One of the strategies is to implement the next gen and then fill in where service is being reduced with what's called microtransit, which is basically metro operated minibus service that serves its stations and such, provides a feeder. The problem is that that definition of the zone that's going to get that service for micromobility includes LAX and a portion of Inglewood, the portion that's south of Florence, and it doesn't go down to the 105 freeway. Mayor Butts made a plea to have it include the entire city of Inglewood. That plea was also not responded to positively. They're going to do the pilot and they're going to see how many people who are outside of the service area, the limited service area, are asking for trips. And at the end of the pilot, they think they can expand the service to include the entire city if it's warranted. So there's going to be a little education process in Inglewood, I expect, to create demand in areas outside of the zone that's being served during this pilot in micromobility. There was also a discussion about the fare that was going to be charged in the micromobility program. Initially, the fare is $1, and Metro had suggested that it go to $2.50 a trip. The board was not satisfied with that, so they passed an amendment from Mike Bonin that said you're going to have the $1 through the pilot and then come back to the board to determine what the permanent fare is going to be. I doubt it will be as high as $2.50 because that's much higher than the Metro fares are in the rest of the system. So I think that that pretty well covers the Metro meeting.
Thank you, Steve. Are there questions for Steve? All right, may we now have the Transportation Committee report?
I'm gonna have to ask Steve, give that because I missed my first Transportation Committee meeting in ever, so.
When we come back to it, let me get it up on my agenda. Why don't we loop to something else and then I'll give you a sign when I have the agenda in front of me and I can talk to it.
Thank you. All right. So now let's talk about the South Bay program, action items, reports, and updates. So first we have the Metro 110 Express Lanes contract extension.
Okay, this is on your agenda as an action item in this place because it did not get to the steering committee. And so I didn't want to put it on the consent calendar, but it is actually a very simple thing. We've been working on express lane issues for Metro. And what we do is it's mostly public outreach. We give information about transponders and other things. And we've been doing that for a year. The contract was $48,000 last year. This is a simple contract extension, which we received after the steering committee, and they asked us to please expedite it because it's they wanted to get it signed. So we're asking your approval to extend the contract at the same rate as last year for an additional year.
Okay.
I'll entertain a motion.
So moved, Horvath.
Second, Franklin.
Thank you.
I'm
May we
ready.
have a reverse roll call, please?
Oh, sorry.
Sure. Any opposition to approving the contract extension? Any abstentions?
Thank
Okay.
you. I guess now we can go to Steve if you want.
Yeah, back to me. I've got it in front of me. Sorry about that. First thing that we talked about was, as you know, for the last 10 years, we've been doing what's called the annual performance evaluation reports. Metro requires a quarterly report these days for the projects that are funded under Measure R and M. It turns out that nobody was paying attention to our reports, so we've decided to not do them in the future. We will be, our role will be to help develop projects and get them into the Metro budget request, but we will not be doing oversight except on an annual basis as we review the project progress and figure out how to change cash flow. Which brings me to the Metro budget request status. We're expecting by the end of this month to get an updated estimate of the funds that could be available in the next year or two under Measure R and Measure M. That's the new funding. Once we get that, then we can have the one-on-one meetings with current project sponsors, and we can consider, if we have any money, how much funding would be available for new projects in the next couple of years. The third thing that we talked about was the congestion pricing study, or what's known as Metro traffic reduction. There's been no progress since last month's report. The Metro is in the process of doing a staffing analysis that includes the traffic congestion reduction study plus a consideration of making Metro fare free or doing fare capping. Mr. Washington imposed a non-disclosure agreement process for staff. First time they've ever done this regarding these analyses. So he's going to keep the internal staff discussions internal by making anybody on these task force sign a non-disclosure agreement. The board was not particularly comfortable with this approach. There should be more discussion coming in upcoming months. Finally, the 3-month look ahead was focusing on getting back into the business of doing a Metro budget request. Anything else, David, that I missed?
I was going to add something though. This whole change of roles and responsibilities with Metro is something that I think we want to take a little bit more time to look at. How often we're going to do reporting, how often we're going to talk to our cities. And so that will be a subject at the next Transportation Committee meeting, and probably we'll bring a report back to the board. So I think we just want to give it more time and attention. We are eliminating the report that Steve mentioned, which was nobody was reading, but the question is, how much should we be there? And that's what we're going to be looking at.
We have a cooperative agreement and a funding agreement, and we're trying to comply with the terms of that agreement,
right,
rather than just ad hoc doing what Metro staff is asking. We do still have a contractual obligation that we need to address formally in addition to changing behavior.
Yeah. Okay.
Thank you, Steve.
Yep.
Let's go ahead and move on with advocacy regarding housing legislation. Still on the South Bay program action items.
Right. Well, this is these are reports and updates mostly now. We finished our action item, but what's happening now is that several of you were nice enough to get me the names of lobbyists for cities. And I talked to 4 lobbyists who all talked to each other in Sacramento, and they came up with an idea, which we're not going to do, which was to have in December, to have a forum with all of our elected officials and talk to them about housing legislation. The steering committee decided that that really wasn't the way to do it, that all of the legislators in one room and then us presenting to them and trying to have a dialogue is really not going to get their attention, and we're going to have to do one-on-one meetings. So there is a subcommittee, and if you're interested in being on it, please let me know, that we'll be meeting November 2nd to talk about what kind of advocacy we should be talking, sort of to talk about these visits. What do we want to say? And one of the things that became really clear after our legislative briefing is that legislators, although we think that they're not paying attention to local control, they're not paying attention to climate change, they're doing this in silos. Apparently they think they're doing all those things. So they would like, Senator Allen in particular said, we need you to tell us what you want. Don't just tell us no, tell us what you want. So the meeting on November 2nd is with the subcommittee that will talk about how we can suggest things for legislation that is that makes sense for us, instead of besides saying what doesn't work, what does work. So I would invite anybody that might be interested in participating in that to please let me know. So that's where we are with that. I can go on to fiber.
Yes, please.
We did have a meeting. Senator Almir Suchi, I don't know if I mentioned this before, but he's very interested in our fiber, and he's very supportive. And we had a meeting with him, and he was very anxious, as a former school board member that he is, for us to contact the schools. And so our consultant Magellan has actually had we had a meeting with CNIC, which is the network that schools use. And our consultant then had a much more technical meeting with CNIC. And we're talking about ways we can possibly collaborate. And it's very exciting. And I haven't gotten back to Selma Mirasucci yet because I don't have anything specific. But if we can use our network to do more with collaboration with the schools, I think that would be really, really enhance it even more. Also, the governor has issued an executive order in which he has asked the California Broadband Council, which is a group that exists, to come up with an action plan for the state of California by December of 2020. This week, we submitted comments to the action plan that basically talked about our fiber network, our neighborhood center concept, and how possibly instead of trying to get high-speed internet to every single home right away, they could have success if they brought it to neighborhoods. And so we took, our sustainable strategy, turned it into a letter for the action plan, and that has been sent in because they were meeting this week. Then we also formed a subcommittee of some people who were involved in application development. And that committee is involved with, we've had public works on it, IT directors, we have a couple elected officials on that committee, and we had some community development directors. At the last meeting, which was last Monday, we had this incredible, I thought it was incredible, presentation by Dave Daigle from American Dark Fiber, who talked about all the roles and responsibilities in what the FCC does, what the PUC does, what rights and responsibilities he has as a provider, and what the role of cities is. Our next meeting is going to be November 16th at 3 o'clock. We're going to invite everybody because we're going to have one of our points of presence there. They do a lot of storage and they do applications that we will be talking about. These are really interesting meetings. And now that we have the network, we really need to understand its potential better. But I am saving the best for last. On November 17th at 10:30 in the morning, we are going to have a celebration, and I hope that you'll all save the date. It's going to be virtual, and we're sending out the invitation shortly. We have waited and waited and waited to thank the people that worked so hard to get the fiber network up and running. And so we will be honoring and celebrating not only the fiber network, but the people that helped us get there. Colleen Farrell, our new communications director, is doing video interviews with some people, and we're working on the program. It's called, we're going to have a connect ceremony. So we're going to ask each city to participate and connect your fiber cable symbolically, if nothing else. And I'm delighted to say that we have confirmation that Public Utilities Commissioner Martha Guzman Aceves, who has been extremely supportive of our network, has agreed to participate in the celebration as well. The whole thing's going to be, it's virtual, it's going to be about 30 to 40 minutes at the most. So please save the time. We would like every city there to connect the fiber and to celebrate what we've accomplished, because it is indeed an accomplishment. So that's my fiber report. I don't know if anybody has any questions or would like to add anything. Shall I go on?
Yes, please. Go on to the SCAG Regional Early Action Program.
So at the last meeting, I told you that SCAG has this funding from the state, I think it's from HCD, to promote housing. And so we've been working with the community development directors to figure out what we could do with the fund. Funding is dedicated to each subregion, and it's based on our RENA allocation. We don't actually get the money. SCAG will have the money, although we can get some administrative funds from this. But the purpose of the funding is to accelerate housing. So we've been working with the community development directors on what we could possibly do that would use what we're getting, which is about $600,000 until June of 2023 to accelerate housing. And a lot of cities are not, one of the things we want to say about the housing legislation is before you go and accelerate housing, maybe you ought to figure out what's going on right now. And so what we're trying to do is figure out how to use this money to understand what's really going on and then show how that will help us accelerate housing in the South Bay. So we have 4 projects that we have told SCAG we're going to submit. There was a 5th one. Torrance wanted us to submit a project on seismic surveys of some of their sites. No matter how we looked at it, and no matter how SCAG looked at it, they said there's no way that seismic stimulates housing unless for some reason you're going to take the building down and put up more density. So Torrance has agreed to go look for funding somewhere else. They're still doing that study, and several cities were interested in it. So we're hoping that Torrance will share their results with other cities. But we have 4. And the 4 we have are Redondo Beach is taking the lead. We've asked cities to take the lead because Wally and I are working on this, and we are not experts. And your community development directors are the experts. They know what's going on. So Torrance's community development director, Brandy Forbes, has been very helpful in suggesting a study that several cities would be interested in, which has to do with SB 330 compliance. And as I'm saying that to you, I realize I can't explain it to you very well, but it's a legislation that is inhibiting, I think it's causing requirements that are possibly inhibiting a lot of what you need to do. So she's written up a proposal, which we're going to be sending to SCAG to get their approval. I should say we need SCAG needs these to them by November 30th. So we're working on all this development right now, but I just received Brandy's write-up, and we'll be taking that to SCAG and making sure that it complies. The second one we have is on ADUs. We would like, several cities are interested, and this is one of those places where we're trying to learn about ADUs, and SCAG wants to make sure that they promote housing. We're trying to figure out how we can learn about ADUs, what's happening in your neighborhoods, what's happening with parking and all those other things. Are they really low cost? Are they being rented to your grandmother, or are they being rented to somebody who really needs, is in danger of homelessness in some other way? We're very fortunate. A while ago, I forgot even when I did this, I submitted an application for a UCLA capstone student they're graduate students that do research projects. And in the last month, we heard from UCLA that there is a capstone student that wants to work with us on this project. He used to work for the city of Gardena, and he's very familiar with ADUs, and he knows the South Bay. So we've got help on that, and the COG is going to take the lead on that. And George Gamboa is his name, and he will be working with Wally on that project. The third project is something that you've heard about from us, and COG once again will be taking the lead on, and that has to do with commercial property conversion. Looking at the cities that have expressed an interest, and what we're doing is we're not doing this for every city. Cities have to express an interest, and they have to also probably say that they will use the results to look at promoting housing. So for us to get the SCAG funding. So looking at commercial property conversion, we're going to look at sites that are underutilized commercial and determine how they might be redeveloped for housing and what that would mean for the city. The fourth project, which we have Hermosa and Lomita are sort of taking co-leads, is education and training. We have told SCAG that we believe that one of the reasons why it's hard to promote housing is that the whole atmosphere on the planning commission, on the city councils, and in your communities, do not explain or understand the mandates that are coming down. And so it would be helpful and allow you to have a better atmosphere to make your decisions if we had education and training in this area. So that's the fourth one. We've asked for your community development directors to write up little lists of proposed applications. We will look at them, submit them to SCAG, hopefully get their approval and move forward. If we don't do any of this, we don't get the money, obviously, and it will go to some other subregion. So it's really a use it or lose it. And if we can develop projects which really will provide you some good information, we really want to move forward and use this money to do that. So that's my report on REAP.
All right, can we go on to the local travel network, Jackie?
Okay, sure. I should say we're going to bring the REAP projects back to the November 19th meeting, probably for your approval, final approval. Local Travel Network. The Local Travel Network, as you know, has been funded by Caltrans. It's been going on for several years now. We're into focus groups to get more community input. One of the things that really hit hard on this project is there was a large component of outreach, and the outreach was supposed to start around February, March. So we haven't had the ability to do the outreach we wanted. So we're doing as many focus groups of those kinds of things as we possibly can. I've lost my, and then the final report will come out the first of the year. I think I didn't mention this to this group. I get confused. Wally was on a Zoom, and the Undersecretary of CalSTA, the California's Transportation Department, was on the call. And when he explained the Local Travel Network and what we were doing, she asked for more information. And so we've been able to communicate directly with her, and hopefully there might be some interest there at Caltrans to help us with with actually moving forward on this project. Any other comment? I don't know if anybody has any comments on that.
Are there questions for Jackie on the local travel network?
I'm going to turn to Britt and Grace. Britt for senior services, and then Grace for both senior services and homeless services.
Well, we have a meeting Tuesday, December 1st, senior services, and continuing to work with Silver Nest, and probably Grace has an update on that.
Yeah, so that will take us into the homeless report. And I see that Natalie has shared our screen. So as I mentioned at the steering committee meeting, we were getting ready to launch our Home Share South Bay landing page on Thursday, October 15th, and we did launch it. This is what our page looks like. And this is how people can actually access to go on to the Silver Nest website, which is the online platform to develop their profile. And then ultimately, we are hoping for matches, and then and that they will be working with our Home Share South Bay staff, which is Lori Jacobs primarily, and then we have an intern who's also working on this program. So we're really excited about this. And then earlier this week, I believe on Monday, Jackie sent out an email with a copy of the press release, which actually went out last Thursday, but Jackie's email went to all the city managers and elected officials. So I hope you all received that. And then I followed up with an email to the city staff with whom we work on homelessness issues as well as seniors issues. So we're working on some brochures, or not brochures, but flyers that we can get out to the different staff, the city staff, so that they can share it with potentially with people who might be interested in it. And I want to give a shout out to Inglewood because they've already posted our landing page on their resources page on the website. So we're very excited about that. And as we find out more of our cities that are doing working with us to get the word out, we will be reporting out on that. So we're
Grace, a shout out also to Colleen for getting you an interview.
Oh yeah.
So why don't you talk about your interview a little bit?
Oh, yeah, when they, a typical interview, they grab the, the offhand comment. That's the one that they print, or that's the one that they record. It's like, ay. But yeah, so Colleen did send out the a press release last Thursday, and we did get a radio interview with KPCC radio. So it was part of their NPR program on Sunday morning with the weekend news, and then also Monday morning. And so so actually it was kind of fun. I know that Aaron Baum, my colleague, heard it because he sent me an email first thing Sunday morning. I woke up to your voice. So, but anyway, so I'm excited about that. And we've had some other nibbles from some other media outlets that have printed our press release. And then also Torrance Cable, since Colleen is a reporter with Torrance Cable, she did a story on Home Share South Bay. So very happy about the press that we're starting to get, and hope that continues, and hope that leads to people wanting to sign up for the program. We're at this point, we're really focused on trying to build our kind of our stock of homes. And so we're really trying to reach out to homeowners who may be interested in renting out a room to someone who may need a little bit of assistance in being able to afford living in the South Bay. So does anyone have any questions about the Home Share South Bay?
No, I only
great.
request, Ralph Franklin, I only request that you keep us abreast of any responses that's favorable so we can monitor to see how effective this program is.
Yes, I definitely will. And we will be receiving like weekly actually report back from Silvernest as to the numbers of people and the locations where they're coming from, because who knows, maybe we'll have a little competition amongst our cities to see how many homeowners we can get to sign up for the program. Right now, we did have a meeting with Silvernest this morning, and we've had 2 home seekers already complete a profile. So we're, as I said, we're really trying to find those home owners right now so that we can have some places for the matching to take place.
Grace, it's Olivia.
Yes.
I'm going to suggest that you approach the senior cities where they have senior services. Like in our city, we have a senior service commission and also a senior community area where seniors meet on a regular basis. And I think that might be a good marketing area for you, wherever the cities have, any place where seniors meet.
But right now, my understanding is that the programs aren't open yet. So what we're hoping to do is for any of the senior centers that are actually providing meals to be delivered to their regular attendees, that we want to try to get included a flyer about the program. And we're also going to work with the local YMCAs, because I know that especially Torrance is involved in delivering meals. And Olivia, just so you know, I have reached out to Diane Brown already. So she's my go-to girl and go-to person in Hawthorne with all the seniors.
Okay, so we have questions for you, Grace. First from Britt Huff.
So Grace, that the email that went to the staff was were the city council members on the board here included in that, or have they received the flyer and the email also?
The first email that went out was the one that Jackie sent out on Monday that went to the city managers, and I believe it went to all the elected officials in our South Bay. So all of our elected officials from each of our cities should have received the announcement, as well as a copy of the press release that then had has the link to the landing page in it.
Okay, good. Because I do think in each city, Olivia's suggestion was good, even though they're not meeting or open, they have email lists that they could forward those on to the seniors on their email lists, and even to senior organizations in each city.
Yes, and I really appreciate the comment about the commissioners, because I do know a few of our cities do have commissions on aging. And so I think that's a great avenue as well to get information out. And Lori, my colleague Lori, has been working on developing a flyer that is very succinct with the information, and it also has the landing page link on there, so that way we can get get the information out.
Grace, you have a question from Christian Horvath.
Comment and question. So if I was going to ask about a flyer and or some digital assets from you or Colleen, so that we can post them on Nextdoor, Facebook, just try to push it out to anybody that's following us. And then I'm assuming or hoping that you're talking to the health district, because they have thousands of volunteers, and a lot of them are actually older as well. So I think they would be a great resource for getting the information out to their contacts in the 3 beach cities.
Yes, thank you. And I do have beach cities health districts on our list. The first go around of emails was going out to all of our cities, and now we're going to be working with all of our other senior related organizations, our service providers. I've actually already spoken with PATH as well as Harbor Interfaith about the program. And then we have some of our health related organizations and our hospitals, our contacts at the hospitals as well. So, any other questions? Well, then I'm gonna actually throw it to Christian with related to homelessness, because of all the exciting things that are happening in Redondo Beach. So tag.
Okay, well, it's exciting depending on
Yeah.
who you're talking to. So I was threatened with a lawsuit yesterday. So yeah, it's been a fascinating couple days. What Grace is referring to is that Redondo on Tuesday night approved creating a 15-bed or 15 pallet shelter space within Redondo Beach, primarily to do 3 things. One, to deal with all the individuals that are coming back from Project Roomkey sites that have not been able to matriculate beyond Project Roomkey just due to lack of beds or housing. 2, to work with our enhanced pilot project homeless court system that we have going on here. And 3, of course, as you are all well aware, to also just act as a supplemental solution to the Martin v. Boise ruling, 9th Circuit ruling that allows no enforcement for encampments in a city that cannot offer a bed. So it was a long meeting. I think Grace stayed up for, and I know Jennifer did for the whole meeting, but we ultimately decided to place the shelters near the Galleria, where our transit center is ultimately going to go. And that'll be for 6 months. It's then supposed to move down to Moonstone Park in the harbor for the remaining 7 months. County did give us a good deal of funding, and just so everybody is aware, this will be even though it's only 15 people initially, because of COVID, we can only have 1 person in each of the pallet shelters at a time. The area will come with full wraparound services, 24/7 security. So, the fears that a lot of people have is this is just going to be some type of shelter that, there's going to be people just wandering in off the streets. And this is really going to be a very prescribed and transitional situation to help people move off the street into that location. And then as they are getting services and moving through our homeless court system or whatnot, eventually matriculate out to some type of permanent supportive housing. And that's it.
Thank you. Are there questions for Christian? Thank you, Christian.
And then actually, is Axel still on the call from CD15? Because in Council District 15 for the City of Los Angeles, they're actually also developing pallet shelter. And I think they're going to be doing something near Harbor College. And then they're also looking at safe parking. So at our next Homeless Services Task Force meeting on November 4th, we will have, well, actually Christian's going to be giving an update, and also Gabby Medina from Buscaino's office will be giving an update on what's going on in CD15, as well as we're talking about street medicine, and we have Caltrans protocols on working with people experiencing homelessness during COVID. So that's
Thank
it.
you, Grace. All right. Next,
Oh,
we,
wait, there was something else. Grace, did you want to, I'm sorry, talk about the education and training modules?
Those are going to be coming available, and we're hoping that they're going to be ready to go by the end of the month. And they will be, there will be areas where each of our cities, when we'll work with our cities to personalize them for your specific city. But it's a general overview of looking at, for city staff on, it's almost like a myth buster, so it's going to talk about myths versus facts in dealing with homelessness issues. So stay tuned. Those will be coming out hopefully by the end of this month. That's our goal. That's our timeline.
Okay.
all right. So now we're on to police operations and public safety in the South Bay.
Okay, about a month ago, I think, I sent all of you questions from the Public Safety Subcommittee, and they were questions that were Councilman Mayor Butts helped us put together. And the idea was for you to ask your police chiefs about the answers to the questions and to start a dialogue with your police chief. I have heard no feedback. I don't know if anybody has done this. What we did is we asked people if they had done it, if they felt comfortable sharing with the COG. We would like to get those answers by this coming Monday was the deadline. I did get today, I got something from El Segundo asking me to share some information, but I haven't gotten any information from anybody. So I guess my question to you, all of you, was were these questions helpful? Have you used them? Is there something you'd like to direct or discuss that the Public Safety Committee can use for another special meeting? So it's really a discussion item for you.
Is there anyone who'd like to kick it off?
My question to everyone, has anyone done the ride along yet?
I have.
I have, Boyles has, but that was pre the questionnaire.
So it sounds like in the past, some people have.
The answer to your question is, Jackie, I have met with I've met with my police department on those questions. We're not sure how much we're going to share, but it was very illuminating, and I'll be ready to share some general things anyway, as far as my general impressions of the discussion.
That would be great.
But I have had the meeting, yes.
Anybody else? Because I don't know if we should call a police subcommittee meeting or not. I guess Hildy has her hand up, I think.
I do.
Hildy, go ahead.
So I've asked for the answers to the questions. I haven't received them yet. But in looking at the questions, I still find huge value to having the discussion, because there's a lot of questions on there that we really don't even know really what the context is, or what some of the language is, and what the questions are really asking. If we still have that discussion, I think there's a lot of value, even if our individual police departments don't give us all the answers or any of the answers necessarily. I've asked for them by tomorrow, and I've received word that they are working on them. So that's all I can say.
Is there anyone else who would like to talk about this? Okay, then I guess we'll just move on. Regional.
Then I will talk to the police subcommittee about what they want to do next. I'll be sending something out. Okay.
Thank you.
Moving, you want to move on? Regional coyote management. The city of Torrance wanted to know if other cities were having coyote issues, and if they would want to work on some kind of a regional program, and if they had budget to do such a thing. Torrance created the survey. I sent it out to all of the cities and bugged the ones that hadn't responded until I think we got responses from I think 1 or 2 cities didn't respond. The responses were pretty overwhelming that there is a coyote problem in the South Bay, that cities do not have this as a priority. They do not have budget for it. And this is just not the time they can move forward. So I've given those results to Torrance, and maybe Councilman Chen might want to mention something. I know that Torrance acted on something yesterday, but it will be just the city of Torrance at this point that I don't know.
Actually, I was not at the council meeting. I was actually, that was one meeting I missed. So I will take a look at it. Yeah.
I saw something on Nextdoor. I think that there's going to be a 2021 coyote management plan or something. So,
Yeah.
but there is, and maybe other cities can learn from it, but there will be nothing more that the COG is doing unless something changes.
Stay with that for a moment, please. This is Ralph Franklin. So to our surprise, we thought it was LA County Animal Control that we reached out to, only to learn that it's wildlife, fish, and game, which is a state issue, and they have not reached out with any funding set aside to help assist the cities. So therefore, it has become a major challenge and not a priority for us. Just point of information.
We tried, when we had our coyote task force several years ago, I asked, they kept applauding us, you know, you're doing such a great job and how wonderful it is. And I said, well, you know, we could continue if we had a little money. Can we get a grant? Can we use something? No, there's no money for it at all.
Maybe it needs to go on the public safety subcommittee because, you know, South Bay don't want to be the first one to have a human incident.
Yeah.
Well, that's a good point, and we're certainly seeing a proliferation of them. So
yeah, I'm told that they're not afraid of people anymore.
I'm willing to work with anyone who wants. If you want to set up a committee to study this, Jackie, or if you want to move forward with this, I'm willing to work with you because this is a problem I think we all face. And again, you said you reached out to Wildlife, Fish, and Game, but did they absolutely refuse or did they just ignore you?
Ralph? No, they just said there was no funding. There was no funding. But we went
ever or just not right now.
No, there was no funding, nor did they offer to provide funding. They relied on the cities handling that themselves, but you can't euthanize them. So that's another challenge.
Probably one of those things that there's no funding now, but you know, back in the days of my profession, once an incident happens, there will be funding.
Oh, I agree with you.
But then that's a reactive mode.
But I don't know, as far as moving forward as a COG, I mean, we've just had this survey in which all of the cities responded that although it's an issue, it's not a priority. So I don't exactly know what we can do, how we can add value to this discussion at this point.
And I echo those sentiments, particularly when all the cities are adjusting to the loss of revenue due to COVID-19. Thank you.
I would say it is a growing priority again in our city that, you know, we would like to be involved in this because we are getting more and more complaints about, you know, aggressive incidents. And I agree with George. It's, you know, you don't want to just wait for something to happen and react to it.
We can, oh, Jennifer's got her hand up, Madam Chair.
Oh, okay, I didn't see her. Jennifer?
Pardon the disruption here. I just wanted to say okay, Dylan. I apologize. Okay. No, I just wanted to say that the county's agricultural commissioner's office has a really great coyote unit, and they are available to educate any city or community group. There's there's a really great expert who leads that unit. His name's Jim Hartman, and I could facilitate with him if anybody would like a presentation, or he can provide various educational opportunities. So they're available and they're ready to assist any city or
If you,
group that-
Jennifer, if you send me his contact information and some of those, what you just said, I can send it out to all the cities.
Please do.
Sure.
Thank you, please.
Yeah.
Wonderful.
Jennifer?
Thank you, Jennifer. That's a great idea.
And sorry about that craziness.
I understand. I have grandkids. I understand.
Madam Chair, this is George. I have my hands up.
Okay, go ahead, George.
Yes, it was a comment. Thank you, Jennifer, for sharing with us. Based on the last time our city talked about coyote management, not this Tuesday since I wasn't there, I had the impression that LA County seemed to be the response when we asked for help. It was something to the order, we're already at our max. We have no more capacity to help. It is a regional issue. You know, it's one of those things, you know, if we have a trapping program, at some point, if these urban coyotes are smart, as a lot of people say they are, then that means they will go beyond the boundaries of Torrance. Hopefully, you know, maybe they'll know, you know, this is not the place I want to go hunting. Then they'll go out, then, you know, then it's almost like the homelessness issue, right? There's no really boundaries, right? They kind of, they you know, they just go wherever they can to roam as freely as possible, just so, you know.
Madam Chair, if I could just respond to that.
Yes, please.
So it's not a matter of that they're unwilling to help. They don't have the capacity to take on additional contracting with any cities to do trapping. So they don't have the capacity for that, because that is one function of that office, is that they do contract for trapping. So they're not taking on any more contracts, but they're absolutely available for education.
Yeah, I understand. That's that exact.
Jennifer,
what was that?
What is the name of the office?
It's the County Agricultural Commissioner Weights and Measures Office.
Yeah, Jennifer, that was actually what I was saying. The response was they don't have enough capacity to do the trapping. That's the help we probably all need, if there's a way to get a message back to the leadership.
Thank you. Okay. Jackie, you want to talk about the General Assembly?
Well, I was going to talk, I was going to ask Christian if he wanted to give an update on that. Christian, do you want to talk about it?
Sure. We had a staff meeting today over General Assembly. An RFP has been issued. We're going to do this virtually on March 18th. So we are looking for, we put an RFP out to try to find somebody to help us put it on, so that I don't know how many people went to the league event that was virtual, but, you know, we're going to try to figure out how to do that that full day in our own virtual way. Right now we're looking at pretty much the same topics and speakers that we were supposed to have this past March. And I so far got more than 80% response back from those people with their availability. And then we're also trying to figure out creative ways to do vendors and or sponsors. So we'll have more information, I think, to report at the next steering committee meeting as it relates to, you know, specifics. So.
Thank you.
I do have one other.
Yes.
We discussed this at the steering committee, and you will all be receiving an email, maybe even right after this meeting, that we have a new office, as you know. Ralph has actually toured the office, and it's got a lot of wall space. And so what we thought is that we would ask each of the cities that are, and the county that are involved in the COG, to give us a gift, a housewarming gift, if you would. And that gift would be a color photo framed 20 by 24, and I've mentioned this to the city managers already. And that color photo would be something that depicts your city. What's something that your city wants to hang on our wall that says Lawndale or Palos Verdes Estates or whatever. And if you could put the city name on, that would be great too. We have a main hall that goes to the boardroom, and we will be putting the city pictures on that wall. And if we're not, hopefully you'll be able to see them on the wall soon. But if they come in before we're actually meeting in person, we'll show them at our board meetings on Zoom. But we do want to hang them. And so we're asking each of you to give us that as a housewarming gift. And I will be sending you an email. If you have any further information, any questions about it, please let me know. But I hope that you'll all share with us something that really depicts your city to you.
And if you remember, Mayor Butt said just one.
Yeah, I know. Yeah. Inglewood wants to do the whole wall, right? Yeah.
Oh,
Thank you. That completes my report.
thank you. So at this time, we will have agency reports, first from the South Bay Workforce Investment Board.
Olivia, these reports are only for anything that wasn't said before, and these people aren't here in the main.
Okay, so we did not get oral reports from any of them?
And we didn't get any written reports from these, no.
We did not get written reports, okay. And nobody's here from any of those agencies? What about Jeff Kiernan? I thought I saw him.
Jeff did deliver a written report, which is in your packet. I don't know if you want to add to it, Jeff.
The only thing I would add, that because I did prepare that a while back, is that the trigger cuts that were based on no big surprise. We didn't get any federal funding to respond to COVID or any additional federal funding since the budget was passed. So those trigger cuts did go into effect. Those predominantly are affecting education system, unfortunately. So that would be the only update since I prepared the report, but everything else should be in there.
Thank you very much, Jeff. Okay, so now I guess we're up to upcoming events and announcements. Does anyone have anything they'd like to announce?
I just want to re-announce November 17th, 10:30, celebration of our launch of the fiber network. And then I also want to announce that at November 19th, we will be spending the first few minutes of our meeting honoring our volunteers, as we do every November, and also our former chairs that are leaving public office. So I hope you'll join us for that. And if you have a volunteer from your city, I sent out a list, and you can help us with a thank you to them. We'd really appreciate that.
Thank you. So if there are no other announcements, going once, going twice, no other announcements? All right, then at this point, I will adjourn the meeting. Have a wonderful month, everyone. We'll see you next time.
Good night.